Hey everybody, we're talking a little bit more about non-surgical treatments for Hallux rigidus. Typically a really nice shoe can get us out of a lot of trouble, and this may be something that's got a bit of a rocker bottom, so we're moving straight through and decreasing that amount of flexibility or range of motion that we're actually getting from the big toe joint as well. Different things that we can put in our shoes like orthoses, like carbon fiber plates to stop that big toe joint motion will help our patients a little bit more. But always be aware of where that foot's going to move. If it can't bend through the big toe joint, patients will typically have to toe off through a low gear propulsive moment, which could overload the outside of their foot as well. So making sure that you're putting patients in a comfortable position, but also not overloading anything if we're taking the force away from that big toe joint. Other things that we can do is really reduce the inflammation and swelling around the joint. And one of the things that I use quite commonly for that is photobiomodulation therapy or laser therapy. When we're undertaking this type of therapy, it really will reduce the inflammation, the pain, any sort of concerns around that, and that can really help prolong the time until surgery if the patient's not in a good position to undertake that sooner. Some people, when they don't maybe have as much joint destruction as what we're seeing here, may be appropriate for a corticosteroid injection. And that's going to, again, really reduce that inflammation and the swelling around the joint and hopefully take away some of the pain associated as well. Other things that we can do is like 5% Prolotherapy dextrose injections to reduce some of the pain and the hypersensitivity around the joint from some of the attributing nerves. And this I've found to be helpful for patients, in the short to medium term, definitely not the longer term unless we're doing several repeat injections down the track as well as their initial course. But definitely something that we can look at. In other ways that we can treat this type of condition pain-wise is with our non-steroidal anti-inflammatory drugs and our other medications, and it's definitely worth having a bit of a consider whether that might be a good option for our patients in these cases. But when all that fails, then we're looking towards a surgical option, which we'll talk about in one of our other videos. In the meantime, hit the subscribe button, check out some of our other videos, and we'll see you on one of those sessions. Cheers.